How to treat a swollen vein. Swollen veins can be painful and unsightly. Veins can swell for quite a few reasons, though they most commonly occur when there is something blocking them or hindering proper blood flow. Two common conditions that can cause swollen veins are varicose veins and thrombophlebitis, a blood clot in your veins. You will likely notice them bulging near the surface of your skin, and causing you pain. In most cases you can reduce the swelling at home. Make sure you take action against swollen veins quickly, as if you leave them alone, they will likely only get worse. Finding relief quickly. Use warm compresses to promote circulation. When you apply heat to your veins, the heat helps the veins to open up and promote blood circulation. When you have good circulation, your veins are less likely to become swollen. Make sure that the water is not too hot by rubbing the cloth on the back of your hand. You can also use a hot compress that you heat up in the microwave. Leave the heated cloth on the affected area for 15 to 20 minutes. Take the compress off after 20 minutes. Apply the compress at least 3 or 4 times a day. Put on compression stockings. One way to get relief from swollen veins is to put on compression stockings. These are tight-fitting stockings that put pressure on your legs to help push blood out of your veins. There are 2 types of compression stockings you can get without a doctor's prescription, or you can get the strongest kind by talking to your doctor. Support pantyhose. These are merely tight stockings, which offer the least amount of pressure. They will provide pressure to your entire leg, not a particular part, but can be helpful if the swelling isn't serious. Over-the-counter, OTC, gradient compression hose. These are sold in medical supply and drugstores, and will provide more targeted pressure. Look for products labeled gradient or graduated. By talking to a doctor, you can get prescription stockings. These are the stockings that give the most pressure to your legs. They can be targeted to different parts of your legs to make sure you get pressure where you need it most. Make sure you wear them as often as directed. If you do get a prescription, don't stop wearing them without consulting your doctor. Elevate your legs. To get blood flowing out of your legs and back towards your heart, lie down and raise them above your heart. Elevate your legs at least 15 minutes, 3 to 4 times a day. Some good ways to elevate your legs include putting pillows under your legs while you lie in bed, lying on a couch with your legs elevated on pillows on a chair in front of you, or leaning back in a reclining chair that will elevate your legs above your heart. Do not elevate your legs more than 6 times a day, as it puts a good deal of pressure on your veins walls. Consider other medications. If you are suffering from thrombophlebitis, you may need medication that thins the blood or dissolves clots. You will need a prescription for these drugs, so talk to your doctor about the best options for you. Blood-thinning medications will prevent your blood from clotting, creating better flow in your veins. Common blood thinners include heparin or fondaparinux, sold as Arextra, warfarin, Comade, or rivaroxaban, Xarelto. Clot-dissolving medications deal with clots that already exist, and are usually used for more extensive and serious cases. These include Dolplase, Activase, and will dissolve blood clots currently in your veins. Use natural remedies for reducing swelling. If you are uncomfortable, or unable, to take NSAIDs, consider some natural remedies to reduce the swelling. You should talk to your doctor about using these treatments as well, making sure that your dosage is right and that you avoid complications. Licorice root extracts can be taken internally or externally. Make sure the form you take it in is diluted properly. Avoid using if you have heart disease, hormone-sensitive cancers, breast, ovarian, uterine, or prostate, high blood pressure, diabetes, disease of the liver or kidney, low potassium, erectile dysfunction, or if you are pregnant or breastfeeding. Apply marigold herbs to the affected area before putting on compression, either a cloth or your stockings. Epsom salt baths can also reduce swelling. Add 1 to 2 cups of salt to bath water and let it dissolve before soaking in it. You don't need to wash yourself with it, just sit and relax. Take at least 1 bath per week, or soak your feet in lukewarm water with Epsom salts daily. Stretching to promote circulation. Do leg stretches after sitting for a long time. Whether you are working at a desk, sitting in a car, riding in an airplane, or spending a lot of your day sitting down at home, make sure you stretch a few times a day. Sitting all day can cause your veins to become swollen because of decreased blood circulation. There are several good stretches you can do, even while sitting down. Sit with your legs straight out in front of you under your desk with only your heels touching the ground. Curl your toes so that they are pointing towards you and hold this position for 30 seconds. You should feel a stretch in your calf muscles, however, do not stretch so much that you feel pain. Point your toes away from you and hold this position for 30 seconds. You will feel a stretch in the front leg, but make sure that there is no feeling of pain. Stretch your chest a couple times a day. Your legs are not the only thing that need to be stretched. This chest stretch helps your chest muscles and strengthens your back muscles to combat poor posture. Having good posture helps to keep your blood flowing smoothly throughout your body. Sit up tall in your chair. Imagine that there are strings from the ceiling that are pulling your chest upward. Interlock your fingers, and turn your palms toward the ceiling. Lift up your chin, tilt your head back, and gaze at the ceiling. Take a deep breath in this position, exhale, and release. Take advantage of any breaks that come during the day. Whether you are sitting at your desk for work, or in the car for a long ride, look for chances to get up and out from sitting. If one isn't coming up, make some time for a break to happen. While in the car, use trips to the gas station, bathroom breaks, even sightseeing to get up and stretch for a bit. These can work even if you aren't actually filling up the tank or using the bathroom. Just a little break from sitting can be helpful for the veins in your legs. When you are at work, look for excuses to get up during the day. Rather than sending an email, walk to the person's desk or office to have a conversation in person. When you go to lunch, walk somewhere for food instead of just sitting at your desk. This can be tough when flying, but for long flights consider getting up and walking to the back of the plane and back to your seat. Maybe get up and go to the bathroom once during the flight as well. Changing your lifestyle. Know the symptoms of swollen veins. You probably know many of these already, since you suffer from swollen veins at times. If you are suffering from these symptoms, this can be a sign you should start treatment and maybe contact a doctor. The sooner you take action, the quicker you can get relief. Symptoms of swollen veins only occur in the area where the swollen vein exists. Common symptoms include fullness, heaviness, aching, and pain in the legs, mild swelling of feet or ankles, and itching. You will probably also see visible swollen veins, particularly in your legs. More severe symptoms include leg swelling, leg or calf pain after sitting or standing for long periods, color changes to the skin of the legs or ankles, dry, irritated, and scaly skin that cracks easily, skin sores that don't heal easily, and thickening and hardening of the skin in your legs and ankles. Avoid standing for long periods. This causes strain on your legs, which can lead to pain and poor blood flow. Find ways to take a break and sit down for a while, breaking up the time when you are standing. When you sit, make sure you avoid crossing your legs. Keep them raised when possible, which will let the blood flow away from them. If possible, probably while lying down, raise your legs above your heart level to further reduce blood flow. Avoid sitting with your legs crossed at the level of your knees. Sitting in this position will lead to a restriction of your blood flow. Your restricted blood flow can cause the lower veins to dilate, because the venous drainage to the heart is restricted. Exercise. Look for workouts that helps to stimulate your legs muscles. This will help your blood to flow back into your heart and through the rest of your body, putting less pressure on the veins in your legs. Exercises that are recommended for people dealing with this condition include walking, jogging, and swimming. Swimming, in particular, is good because it keeps your body horizontal, which means that your blood is less likely to accumulate in your legs and cause your veins to become swollen. Lose some weight. If you are overweight, you should consider losing some weight to help treat your swollen veins. When you are overweight, more pressure is put on your lower body, including your legs and feet. This can cause more blood to go to that area, which can lead to swollen veins. To best lose weight, find ways to control your diet. Limit portion sizes and get a good balance of foods. Look for lean proteins, low-fat dairy, whole grain cereals and fibers, healthy oils, and fresh fruits and vegetables. Avoid eating sweets, fried or processed meals, and foods high in trans or hydrogenated fats. Talk to a doctor about your weight loss goals. He or she can tell you if they are realistic or manageable, and can provide additional guidance to help you reach them. Your doctor will also help you create a diet plan that takes into account any medications you are taking. Quit smoking. Aside from being generally unhealthy for you, smoking can also increase pressure in your veins. Some substances in cigarette smoke have very negative effects on your blood vessels, including the venous walls. It is better to stop smoking so that your veins will not become too dilated, leading to swelling. If you decide to quit smoking, talk to other people so they can help you stick to your plan. Don't be afraid to consider outside help like professional therapy and nicotine replacements.